Well, scientists say the new coronavirus variant that has been identified in South Africa appears not only to be highly transmissible, but can apparently also evade parts of the immune system. The B.1.1.529 strain has been detected in Gauteng, but appears not to have originated from the province. It was discovered a few days ago following the spike in new COVID-19 infections in Tshwane. Gauteng currently accounts for 80% of new coronavirus cases in South Africa. The new variant has also been detected in Botswana and Hong Kong. Now, let's discuss this further. We're joined via Zoom by Professor Ramneek Ahluwalia, a physician as well as a higher health CEO. Professor, thank you so much for your time this afternoon.
Good afternoon, Unati, and it's such an honor. Thank you.
Professor, it's been a very stressful, 48 hours or so, of course, also driven by fear across the globe, but more particularly in South Africa. How worried should we be about this Omicron variant, and how much do we know about it?
So definitely, South Africa has seen a variant that has got about 30 to 32 mutations in the same variant. We haven't seen such a large number of mutations on its spike protein. And I'll explain that it's not just about Omicron, which is the new variant. So actually the fourth wave that we are looking into, or subsequent waves that South Africa is going to experience, depends on four key variables and not just the mutation alone. The first big variable is behavior. The loosening of human behavior is actually where the virus enjoys excess transmission, moving from one individual to the other and finding bodies where it can mutate. The second big variable is young people. And the young people, Africa is a young continent. South Africa is a country of young people, it's a predominant population. And the third variable is vaccination. So in unvaccinated youth, which is where the highest predominance is currently, with loosening of behavior, and adds into a new mutant coming into South Africa, adds into what we call it the trajectory or the definition of the impact of the fourth wave. So I think, yes, a lot has been spoken about the new variant. Definitely it is a sign of a bit of a concern because there are mutations that we have not seen so many on it, which gives us indication that the virus has found a human body where it could sit and reside and start changing its shape and color so that it can defeat. And all the virus is trying to do is survive in a human body. It's trying to survive among humans. So all it will survive is by trying to keep on defeating what humans will allow the virus to do. So I think the four variables that I speak again, loosening of behavior, which is seen, a lot of young people are transmitting this virus and moving the virus around, and they're not vaccinated. And that is going to build new mutants, and that is exactly where South Africa finds itself. And that, if not be changed, will keep on impacting our fourth wave. So the result is that we have to get our young people vaccinated. We have to keep on appealing that in order for our businesses to survive, in order for our president to continue with at least minimal lockdowns, not severe lockdowns, we as people in the country needs to take our role. I'm appealing to parents, guardians to talk to the youth, and I'm speaking to the youth that you will define the trajectory of our pandemic and our success. So you need to get vaccinated, because if you are vaccinated, your body will have an immune system. So even if the virus enters, the immune system will overcome the viral load of the body. Because when the virus enters, it likes to bind to a human cell. It loves the human body. It starts multiplying. In few seconds, a huge amount of viruses are grown in our body, which means our defense system needs to be stronger. So if our defense system is not stronger, the virus will be transmitted more because the viral load is more. So I think, as I spoke, these four variables will define, and they're all interconnected. And so we have to tackle all four together and not just Omicron. And the discussion is not just only about this new variant.
Prof, thank you so much for putting it in such simplistic language and terms. I mean, you speak about, what's at the core of this mutation that we are currently seeing now with this new variant. And at the core of that is human behavior, which is not as simple, is it? Because we are talking then about mindset, shifting the mindset. And then again, we're talking about the youth, who are having to be the ones that have to be the bigger people in this case and vaccinate. But the message is not being driven home. I mean, we're seeing the numbers, they're quite scary. 80% of the numbers that we're currently seeing in the country are all from Gauteng. We know that only 33% at the last count of people in Gauteng had vaccinated. What then needs to happen in terms of trying to isolate as many people as possible, encouraging them to vaccinate, but also making sure that these numbers come down?
So I think there's no rocket science in this whole thing. We have to continuously engage our youth. When I travel from institutions in higher learning to high schools and engaging young people, they have genuine concerns and they ask, because they read a lot about social media and they start thinking about, okay, will the vaccine cause a testicular hypertrophy? Will vaccine cause us to not reproduce? Genuine concerns. But we need to talk to them to say that there are 3 billion people. In fact, by today, there are 3.5 billion people in the world. In fact, about 50% of the world population is vaccinated. And when this is a reality, when we look at the global data, and we see that there is no signs of any contraindications that people are worried about, we need to talk to them. We need to engage them. Whether it's, and I can tell you, yes, scientists talk about sometimes called a vaccine escape immunity. Definitely, whenever you get, so 60 to 70% South Africans already got COVID-19, whether it was from the first wave, the second wave, or the third wave. And now also many South Africans are getting, and you report the new infections every day, means South Africans are getting. So 70% of our population is already vaccinated, which means we did produce a little bit of immunity because we got the virus. Some people unfortunately died. Some people were in the hospitalized ICU, but they recovered. And some people did not have many symptoms, but the immunity remained. But what happens is with time, the immunity starts slowly going down. And then the virus, when it sits into the human body, is trying to also evade the immunity, but doesn't mean it will completely evade. It can. So when the highly transmissibility happens, or the virus is going to be in large numbers going to transmit, what it applies to it is that as soon as it enters the body, it can form a viral load. But at the end of the day, our immune system should be able to overcome it eventually. What vaccines do is it boosts your immunity to overcome that viral load. So not only that the vaccines help in not only ensuring that your body is able to fight the infection, so which means preventing the infection, it also helps in preventing the spread, because when the viral load will be low, you will not transmit compared to a non-vaccinated person. So I think keeping this science, engaging young people, engaging them why it's so important. And if young people do not get vaccinated, they will keep on giving this virus a human body where it can sit and mutate and find another variant. Not only in South Africa, but all over the world. Omicron is not a South African disease. It's a variant. It could have happened anywhere in the world. And it would have originated from a body which was not vaccinated, which could give the body, which was body that could allow the virus to nicely sit quiet and try to understand our human cell and keep mutating, because all the virus is going to try is keep surviving. So I think young people, getting them vaccinated, and those South Africans that are not vaccinated, will only help us reduce the future waves, because not only it will reduce the production of the new variants, but it will also ensure that the transmissibility rates of our infections are continuously going down. And I just want us to believe that this is not about Omicron, because everybody's scared of this new variant called Omicron. But people should be scared of behavior, loosening of people's behavior when they see other person not wearing a mask or not maintaining a social distance. Business must continue. But all we are saying is wear a mask, maintain some distance, and still do your business. Be in open air rather than in closed room, because ventilation assists in reducing the infection quite tremendously. So these are simple, small, certain things which are difficult. And I know there's a lot of fatigue, and I understand what people are going through at this stage. But unfortunately, we are fighting an enemy which we can't see. And the only way we can really tame this virus, and I assure you that virus can be tamed down if majority of our population will stop transmitting, and our behaviors will be important, and people will be vaccinated, and specifically our young people in that regard.
Prof, there's a lot of nuggets that I would like to tackle in terms of what you've just told us. Of course, you're saying that the Omicron variant it's not only about it. These are not the scary things that we're seeing. It's not about it, especially now that we're going into the fourth wave. And I'll tend to agree with you in the sense that projections of a fourth wave were even made during the third wave that we were experiencing in this country. But of course, the announcement by the scientists from South Africa did give off a sense of fear and panic, particularly if you saw how the world started reacting to South Africa, given that announcement. And one wonders, should it have been delivered in a different manner, perhaps with more information in terms of what are we currently seeing in terms of this new variant? President Cyril Ramaphosa is now confirmed to be addressing the country at 8 p.m. tonight, while the nation around, I would imagine, the National Coronavirus Command Council meeting that was held yesterday. What would you like to see happen in the country now, particularly as the president makes his announcements? And of course, taking into cognizance what you have just highlighted now in terms of changing the behavior, particularly the behavior of those that have not been vaccinated, and especially our youth that are far behind in terms of being vaccinated?
I think it's very important for the president to come in and really calm the situation. I think the scientists tried to just alert everybody that there is a new mutant. We were going to look at, we were seeing the behavior was going down. We were actually noticing that the vaccination rates among our youth is extremely low, and our population is not the way we could have wanted us in November, December. And we were anticipating mutations. As mutations happen, there are about 50,000 mutations that the whole world knows, but there are certain mutations one has to keep watching. And there was this mutations that really worried the scientific world. But I think the perception rather created a much more damage for us. The aim is to not perceive a threat like a new mutant in a negative sense, but in a way to say, what can we as South Africans do better towards ensuring that we all play, as we call Ubuntu, where we all play our part to ensure that, yes, there is a new mutant. It was there in the form of a Delta, it was there in the form of a Beta, and it was there when coronavirus existed in our country. And yes, this is slightly becoming more with more mutations. But the question still remains that we can actually block this Omicron very quickly if people still follow social distancing, still follow a behavior with wearing of mask and sanitizing their hands, like the way we learned how to deal with it. Because at the end, if the virus will not move from one human to the other and we block it by wearing a mask, sanitizing and maintaining distance, or meeting in open spaces or ventilating our rooms, the chances will be that the infection will definitely lose down, because at the end, the virus still needs to move from one person to the other. So I think I just want the world to acknowledge that South Africa is an honest nation, is a nation of integrity. And South Africa has informed people that there is a new mutant in the world, not just in South Africa. And this perception by the diplomatic corps for other reasons should not be what it is. And I'm very happy that the president will make an announcement today. That the president has a persona of ensuring that South Africans are waiting to listen to the president. And on the other side, the global world will listen to the president. And I think that sanity needs to bring in place. And we still have a few weeks to see how this variant actually, you might be surprised that our system, and our vaccine immunity will still remain as stronger as we actually anticipate for this infection, to this Omicron not to win over us like we have perceived it to win over us.
Prof, let me squeeze in one last question before I let you go, as we are fastly running out of time. You talked about obviously changing behavior, especially where the youth is concerned. I'm wondering then, is forcing students to vaccinate the way to go? The University of the Free State, Western Cape and WITS have now all made it a requirement for those entering campus to be fully vaccinated against the virus and as higher health. Are you in support of this? I mean, I know that even the city of Tshwane announcing that there is an outbreak at the University of Technology there at the moment. But are you in support of forced vaccinations, as it were?
I do not like the word forced vaccination. I do not like the word mandatory. So there's something called regulations, and we need to understand what regulations are in reality. Now, higher education is a very big and a complex system, post-school. It's not, there's only one component called universities. There's another component called technical and vocational colleges. There is community education colleges, and there's a system with the learner-based systems and stuff, which is attracting similar amount of million students as the universities is. Now, in the universities, we have established what we call the vaccination centers. They have been running over the last 2 months. In order for universities to run, there has to be something called contact learning. Currently, South Africans, students, parents are asking that we are studying 30% only contact and 70% online. But when you have to build a skill, right from a mining, a plumbing, to management, to doctors, engineers, you can't build skills on online system. For a contact learning, vaccines do play a role. But in those universities, where we have now come to a line of a brick, where we have put 2 months of great vaccination promotion program. We've looked at the epidemiology of that site, and things are not working. Students are not taking vaccination, and there's hesitancy. And we've got lockdown. Regulations play a role. It's like when you're driving a road on a highway, and there is a regulation says don't drive above the speed of 100 or 120. There is a regulation to save your own life, but also the life of the others. What higher health is saying to every institution is, when you're talking to regulations, you also can look into a phased approach of regulation. What I mean about phased approach of regulation is, the first is the students in health sciences, because the students in health sciences can actually take the virus to the most vulnerable, which is the patient. Because that is how you're learning the skill, by understanding the human body, by being directly in touch with the human body. And they are at high risk versus vice versa. The other one is residences, because people have to live together, reside together. If you look at Tshwane University of Technology currently, and the outbreak we are dealing is a cluster outbreak which happened in residence. Because in residence, the infection flows very quickly between one person to the other. And then goes with age classification or mandatory for all. So we do think that there will be a time in South Africa. There's a time which has already happened in certain universities, where we are hitting a deadlock with young people not getting vaccinated. And at that moment, it's institutional prerogative, it's an employer's prerogative to take a decision called regulation. At the end, what we want is people to get vaccinated, because we will not win a country's economy. We will not win this waves and subsequent waves if people do not get vaccinated, because that's the only way and the only solution we have in order to curtail down the infection. Otherwise, we have to continuously follow the behavior element, which is actually something that people are resisting to on the similar side. So what does institutions do at that moment?
Prof, thank you so much for your time this afternoon. Really do appreciate your analysis. Professor Ramneek Ahluwalia is a physician as well as the Higher Health CEO.